Amlodipine reduces blood pressure in diabetic patients with hypertension. High levels of blood pressure are a powerful predictor of cardiovascular disease, including coronary heart disease and stroke. Hypertension is believed to affect approximately 60% of patients with diabetes and is twice as likely to occur in diabetic patients compared to the age-matched, non-diabetic individuals. Due to high prevalence of hypertension in diabetic patients, combined with increased cardiovascular risk attributable to hypertension, appropriate blood pressure management strategies should be followed to reduce the risk of future cardiovascular events. Studies have highlighted the additional benefits of titrating amlodipine from 5 mg to 10 mg once daily with regard to lowering blood pressure. The objective of the study is to determine the incremental effect of amlodipine titration to 10 mg daily on blood pressure lowering efficacy in patients with concomitant diabetes and hypertension who did not respond sufficiently with 5 mg dose. The baseline statistic characteristics were compared between the two groups using Cochrane-Mantel-Hansel statistics stratified by the study for dichotomous variables. Paired students t-test was used to analyze blood pressure data. A total of 710 patients were taken for the studies. In that, 100 patients with diabetes and 610 patients were without diabetes. The criteria for this study included Pfizer-sponsored studies of amlodipine treatment for mild to moderate hypertension, and those who had complete data regarding the treatment regimen with known diabetic status. Patients without diabetes and with serious disease conditions like heart disease, kidney failure, etc., were excluded from the study. Patients were provided amlodipine at a dose of 5 mg daily for 4 to 8 weeks, followed by titration up to 10 mg for the next 4 to 8 weeks. Patients in this analysis were then divided into two groups based on the diabetes status derived from medical history, and then sitting blood pressure was measured once or twice at each visit. The sitting blood pressure goal was less than 130 by 80 mm of mercury for diabetic patients and less than 140 by 90 mm of mercury for patients without diabetes. The titration of amlodipine, 5 mg to 10 mg, lowered sitting systolic blood pressure by 12.5 mm of mercury and diastolic blood pressure by 6 mm of mercury from baseline to follow-up. In patients without diabetes, the titration for amlodipine, 10 mg, lowered the systolic blood pressure by 12.4 mm of mercury and diastolic blood pressure by 7.3 mm of mercury. Some of the patients with diabetes achieved their desired blood pressure goal compared to non-diabetes patients. Nearly 12% patients with diabetes attained blood pressure less than 130 by 80, and 25% achieved blood pressure levels less than 140 by 90. Nearly 22% patients with diabetes experienced 31 adverse events, and 29% of patients without diabetes experienced 282 adverse events. Serious adverse events were reported by only one patient with diabetes and 5 patients without diabetes. Significant incremental improvement in sitting systolic blood pressure and diastolic blood pressure levels can be safely achieved in the patients with and without diabetes and hypertension by increasing the dose of amlodipine from 5 mg to 20 mg. Amlodipine can be considered as a therapeutic option in the effective management of hypertension in patients with diabetes.